Well, Dr. Gandhi told me about the idea about serving, people who may not be able to afford, cardiac care, and I saw this as, something very vital, that to cater for people who may not necessarily afford healthcare which they require, and if there's a charity who's taking this demographic into account, I think that's a good thing, isn't it? So, and I see myself as a privileged member of society, and it's all about giving back, and in a small way, And also, I enjoy cardiology. I mean, that's my profession. So it's a win-win as far as I'm concerned. Well, it depends on what you're referring to and at what level. Cardiovascular services, generally speaking, if you're talking in the country as a whole, I think it is excellent, really. I mean, for a developing country, I think our record is something to be proud of. But there's always room for improvement, and it's a fact of life, even in any country, even in rich countries, that there will be groups who aren't able to afford healthcare, and high quality healthcare. That's what I'm talking about, and that's what we should be interested in. Quality healthcare for every Malaysian. And if you're going to provide quality, it stands to reason that there are some people who may not be able to afford, because quality healthcare is expensive. So I believe, overall, I would say Malaysia does very well. I mean, you're talking about what do you think about Malaysia in terms of providing cardiovascular services? Overall, it's excellent, but there's room for improvement, and this is what I hope MAA can provide. It's not claiming to, well, I don't think, to change the state of healthcare dramatically, but if you can improve it, that's something good, and build on it, and encourage more centers like this. I think it could be an impetus, an example. Well, either we have an expanding population, we have an aging population. Now, with reference to cardiovascular disease, I mean, it's growing exponentially. So clearly there has to be more resources being given to the treatment of cardiovascular disease, and we have to ask the question, is it adequate? Is the government providing enough? Is the public healthcare system catering for the increases in need? I believe it's a never-ending kind of problem, but we have to find the resources. I mean, talking about Malaysia, we are a rich country, and we should be able to provide a lot more, I believe. But given the fact that there are inadequacies, that's where charities come in, and the aim is to provide quality healthcare. And as I said, quality means money. And if there are limited resources, for whatever reasons, that's where a charity comes in. Absolutely. I mean, the waiting times are inordinate. But having said that, one has to put in perspective. I mean, I'm very proud of the Malaysian healthcare system. I mean, it's for the record. It's one of the best in the world. But we want to provide better services, and we want to compare ourselves with the very best in the world, and we fall short, and we have to accept that. And what do we do about it? We try and improve things. And with reference to MAA Medicare, you're trying to provide a need which is very evident, and I think that's a great thing. So hopefully there'll be more charitable organizations who will support cardiovascular care. No, definitely not. I mean, private medicine, particularly in my field, I'm an interventional cardiologist. I mean, the costs are astronomical. So, to answer your question, it is not within the reach of the average Malaysian. Because if you come in, for instance, with a heart attack, and if I take you to the cath lab and do a primary PCI, say out of hours, cost could be anything from about 40 to 60,000. Now that's way beyond the means of the average person. But we have to find the money, and there are resources, but it's just a matter of priority. So hopefully, with more charitable organizations and people being more generous, we'll be able to deal with this shortfall in provision. Definitely, because I like to think we went into the medical profession. I mean, clearly, we have to earn a living, and everybody wants a comfortable living, but we also, want to serve the community. I mean, that's why we went into medicine. So definitely, I mean, if there's a need and there's a charitable organization which is willing to subsidize the care of people, doctors are willing to, come in and charge very nominal fees because they know it's for charity and it's going to benefit people who can't afford or who don't have insurance.